Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to talk about Morton Comprehensive Health Services, and joining me is John Silva, the CEO. Welcome to the program.
Thank you. Thanks for having me.
Now, many people refer to, and I want you to give us a history of sort of how we got from Morton, that used to be the name that people referred to Morton as, and now it's Morton. Give us kind of a historical walkthrough of the name, what it meant, the change, and even the communities that it served.
Originally, back about 90 years ago, a public hospital was developed in North Tulsa. It was named after Robert Russa Morton, who was one of the leading African-American educators with Booker T. Washington back in the turn of the century. It was a public hospital. It served predominantly the African-American community in North Tulsa. It remained a public hospital for a number of years through 1968, serving North Tulsa. Okay. 1968, from what I understand, there were some financial issues, and Morton Hospital closed. The year after, Morton Comprehensive Health Services opened, and that was named after a Dr. Morton who served on the original Morton Board of Directors and then also served as one of the transition agents into the new Morton Comprehensive Health Center. It's been a health center since 1968. It's grown to serve both all of North Tulsa, East Tulsa. We have a homeless health center in Midtown, so we serve the homeless, and it's even grown out 50 miles north into Nowata, where we have a health center in that predominantly rural county as well. So it's had a pretty amazing history. In less than 10 years, it'll be celebrating its 100th anniversary, but that confusion is Morton or Morton exists every day. Folks that have been coming to Morton since it was Morton still refer to it as Morton, and so there's a lot of confusion, especially when we hire new young providers trying to understand where this Morton is, because they thought they were working at
Morton, right? Yeah. Now let me ask another question. Morton is a federally qualified health center.
Yes.
What does that mean?
Well, Morton is a private nonprofit 501c3 corporation, but it's designated as a federally qualified health center by Health and Human Services in Washington. And what it means is that Morton provides primary health care services to all residents of the Tulsa area. Anybody's eligible to go, and it cannot discriminate based upon insurance status. If you walk into Morton with no insurance, or you walk into Morton with a Blue Cross card, you're treated the same. You're provided health care services. If you're uninsured, we try to put you on a sliding fee scale based upon the Federal Poverty Index. So that you only pay a percentage of your actual bill based upon family size and income. Also, federally qualified health centers allow Morton to bill Medicaid and Medicare at a higher rate than a private practice or a private provider would. And that's because many of the patients that we see are poor or have limited access to health services, so they present with a number of problems where in a more suburban practice, they may show up with the flu and actually have the flu, and that's the one thing that's treated. So that's an interesting difference. We also are covered for malpractice insurance through the federal government. We're considered a federal entity for the purposes of malpractice coverage, which means that if Morton is sued for a malpractice case, the suit is actually against the Department of Justice in the United States, which saves us a ton of money, which can then be diverted
back to patient
into health care services. And the other unique thing about a federally qualified health center is that it must be governed by a 51% consumer board of directors. So my board of directors, which numbers, I think right now we number about 15. Out of those, at least 8 must be actual users of one or more of our services. And that's the way over 40 years that federally qualified health centers have been able to be sensitive to community needs and make sure that they're not saying they're serving the community, but actually serving the community.
That's excellent. Now, when people come to a federally qualified health center, then should they expect a different level of care? Because sometimes when people hear federal, it's like, oh, okay, there's going to be something that's wrong.
Right.
They're not going to have a certain quality of provider. Maybe there are really no physicians there. I'm just going to see other practitioners, but I'll never see the doctor.
Right.
Tell me about that.
That's a common misconception. A federally qualified health center is, I believe, in many ways, much more comprehensive than a private practitioner. We're Joint Commission accredited. We're one of only two primary care organizations in the state of Oklahoma that has a Joint Commission accreditation for excellence in quality and service delivery. All of our doctors are our employees. All of them are board certified. All of them are on staff at hospital, whether it's the Children's Hospital or it's Hillcrest. Okay. We're not a federal facility. We receive a federal grant to help cover the cost for the uninsured, but about 75% of our operating budget is funded through patient billing. So, like any large group practice, we bill, we collect. Our services are high quality. So it's a misconception because, one, you're usually located in medically underserved areas, and two, the word federal seems to indicate to some people that, well, that's where the poor people go to get below standard care for nothing. And if you walk into our facility in North Lansing, you'll think you walked into one of the most beautiful primary care facilities in the country.
It's really awesome. It's a glass structure, and when I went in, I didn't even think I was in a healthcare facility.
Absolutely.
It almost looks like a gorgeous institute of some sort. So it's a very high quality facility that you have there.
And it's a credit to Tulsa that it was funded and built using 2025 dollars. It was one of the projects like BOK that was funded through 2025. I've been running health centers in various parts of the country for 32 years, and I've never walked into, one, a facility that beautiful, but two, a facility that was built by the county. Funded by the county. That's really extraordinary.
Okay, well, we're going to take a break, and when we come back, I want to talk a little bit more about providers in terms of, can you select who you see? Is that an option there? And then the kinds of services you do really offer.
Great.
Okay.
Thank you.
Please stay with us. We'll be right back.
And 30. Oh! Yo, hey, Allison.
What's going on?
Working on my free throws, just on 30 straight.
30? That's not possible.
Maybe not possible for you, but I've been practicing.
Step back and give me the rock.
Okay. Nice.
1, 2, 11. You know it's harder when people are watching.
Hey, 11's not that bad. All you need are a few pointers.
Thank you. Are you a free throw expert?
Well, no, not really, but I do know excellent teamwork when I see it. It's so much easier to get active and live healthier when your friends are there to motivate you with a little friendly competition.
Now let's get this game started. Oh, she's going for the hook shot. Hook shot. Oh, that's what I'm talking about.
America,
Let's get healthy together.
Welcome back to continue our discussion talking about Morton Comprehensive Health Services. Joining me again is John Silva, the CEO. Now let's jump in. I wanted to pick up on this concept of, can I pick my own provider? Because once again, sometimes when people think federal, they think you're just going to be assigned, and every time you go, you're going to see a different person every single time.
Right.
Tell me about that.
It's not the case. So it's similar, again, to walking into any group practice. If you walk in and you register, you'll be assigned a provider. Obviously, if the provider is off on a day that you have an appointment, just as any private practice, you may see a different provider. But you're assigned to a specific provider and to his or her patient roster. And 80 to 90% of the time that you walk into the health center for your next appointment, you will always see that provider. Okay. We have a number of providers at Morton. People don't realize the size of the medical and provider staff we have. We have pediatricians, we have family practice physicians, we have OBGYN physicians, we have certified nurse midwives, we have physician assistants, nurse practitioners, we have dentists, dental hygienists. We have a full-time child psychiatrist who heads up our behavioral health program with 5 licensed clinical social workers and a licensed professional counselor. We even have optometry, ophthalmology, and optical services.
Whoa.
So you can come in and not only have your eyes examined and lenses prescribed, but you can pick out your frame and pick it all up there as well.
You're right. People don't tend to know that you have that wide array and extent of services.
Right.
Let me ask you, do you have mammographies available for women?
Yes, we just received a Susan Komen grant, which we've had in the past. We have a diagnostic. I'm sorry, I always get them mixed up. A screening mammography machine.
Okay.
So through a grant from Susan Komen, we do. Our providers do breast exams. If they find an abnormality, they'll immediately be scheduled for a screening mammography right at the health center. And then we have a partnership with Project Woman that if you're uninsured and there's a potential issue, that Project Woman will fund ongoing screening and diagnostic care as well if it's an unfortunate case where there may be some cancer evident. So we have a mammography service, but we're really expanding our screening and diagnosis efforts.
That's excellent. Now with this, in terms of the Project Woman, your connection there, people would want to know, okay, do I have to pay more money? Does that work on a sliding scale, or do they shift over to that particular organization for their intervention, and just basically you're involved in terms of their physician there with follow-up?
I'll give you an example. If a woman comes in and sees her primary care physician, and as part of that annual physical examination, through the breast examination, there's an indication of maybe a lump or something that doesn't seem right. Then through the Komen grant, they'll be screened on the mammography. Okay. Now, if something shows up on the mammography and you're not an insured individual, if you have insurance, thank God, and you'll be referred on to a specialist and for more review. But if you're not, in this society right now, you're kind of between a rock and a hard place. Okay. With Project Woman, we're able to then, for those that are uninsured, partner with Project Woman, where they will essentially give them a coupon, and that coupon will allow them to go for diagnostic screening, and then also assist in paying for any follow-up care that might be necessary. So it's a great system where in the past, and we talk about this a lot, but in the past, you might be in your 50s, your children might be grown, your husband may have passed or be gone, and suddenly you have the possibility of a horrible disease and you have no insurance.
Right.
So that pattern, I think Tulsa has put together a very nice kind of safety net for that particular issue. There's a lot of other issues there aren't safety nets for, but
that's one.
That one I think we're doing a very good job with.
Now let me ask this question, because with males and prostate cancer and screenings, etc., I don't want to leave the men out. What kind of services do you offer there at Morton for prostate screenings and follow-up if there seems to be an issue?
We do, as part of the annual physical activity for all of our patients, for all of our male patients, we'll do prostate exams. But it's a great point. If something comes up on the test, and again, you're uninsured, we will do our best to refer you to the appropriate specialist. But we all know the present status of healthcare, and we can't always guarantee that individual who may have an abnormality is going to be able to access follow-up care. And that's one of the tragedies about our current healthcare system, is that we're able to screen at an FQHC and identify a potential issue that, if treated, could be easily cured, and yet sometimes for folks that don't have insurance, they have no place to go.
Exactly. They sort of get in that, like you said, they don't have a safety net for everything.
Right.
Now with Morton, and then our last segment, I want to talk about initiatives that you're involved in the community. But with Morton, how much of a referral system, you talked about Project Women and these others, if persons are referred out, do you keep sort of the management of that care so that you keep in contact with the specialists that they're referred to and you're continuing to work with the patient in your environment, or is it once they're gone, they're gone?
No, ideally, the ideal is that we make a successful referral. We have referral staff that work 5 days a week. We spend an awful lot of time on referrals, but we spend an equal amount of time on making sure we get the information back.
Okay.
There are times, because of the lack of connectiveness of the healthcare system, that we struggle to get that information back.
Okay.
But the way it works is that we refer somebody out for a test or a screening. We'll get the patient referred back and the record referred back. The exciting thing is with the health information exchange that's being funded through the Beacon Communities, in a couple of years we'll be able to instantaneously send the referral and then get the referral information back immediately without having to chase the patient or the information, which is pretty exciting.
Okay, and I want to ask you that real quickly before the break too. That also involves this concept of electronic medical records.
Oh, yes.
So how heavily involved is Morton in that, and how safe is it? Because as consumers, we're very concerned about anything electronic, and it's going to be hacked in, stolen. Tell me about that.
We're a very technologically advanced health center. We have we have had an EHR, electronic health system, for 5 years. We now have an electronic dental record system as well. We are absolutely, totally compliant with all HIPAA, Health Information Privacy Protection Act requirements. Legal review is constant. We want to make sure that only the provider and whomever, that patient's provider and whomever else that patient may designate will have access to their electronic health information. We have our patients sign approval to be able to share the information based upon referral needs, but it's a constant concern of ours as well.
Okay, but like you said, vigilant and monitoring and making sure all those safeguards are truly there.
Yes.
Okay, well, we're going to take a quick break and come back and talk about the community outreach. So please stay with us. We'll be right back.
Up to 40% of businesses never recover after experiencing a major disaster. Make a plan at ready.gov/business.
Did you know that getting up and getting active for just 60 minutes a day is all it takes to help you get stronger, look better, and feel great?
Or that fresh fruits and veggies aren't just healthier and crunchier, they can taste better too?
Eating better and getting more active is easier than you think.
Yeah! Keep watching for some fun and easy ways to discover the magic of healthy living in your life.
America.
Let's get healthy together.
Welcome back. To complete our discussion talking about Morton Comprehensive Health Services, joining me again is John Silva, the CEO. Let's jump in now. I want to talk about community outreach efforts, the things that you're doing. Before I get to some of those, and I want to mention the Tisdale Center that's forthcoming, let me ask this one question. Does Morton do home visits? Because you talked about having nurse midwives, and some people may say, they come into the home for deliveries.
No.
Do you clarify for us, do you do home visits?
We're able to do home visits. It's usually at the discretion of each individual provider and the specific need of the patient. But we don't do many home visits. For homebound and for other patients that we've seen for years, yes, we do.
Okay.
But deliveries at home, no. The liability issues for Morton would be just
too great.
Too great.
Okay. Now tell me a little bit about the Tisdale Center, Wayman Tisdale Center that's being built in North Tulsa. Tell me a little bit about that, and then what is Morton's involvement? Because that's partnering with OU and others.
Okay. We have a memorandum of agreement with Morton that we will work with them to co-locate primary care services at the new Tisdale Center. The Tisdale Center essentially is going to try to address the issue of specialty referrals for the uninsured by putting together a matrix of specialists that will staff the Tisdale Center, whether it's orthopedic or ENT or cardiovascular, but a source for referral. We're excited because some of our patients that we have difficulty getting into a specialty referral, we're going to be able to do that with the Tisdale Center. But we also recognize that some of the people that will be appearing for specialty services may not have, let's say, a good medical home. So we want to also have primary care services there and direct referral and transportation between Tisdale and the North Lansing site, so that we can, the goal for us, and I think it is for OU and specialty and the Tisdale Center, is once we get somebody into a service, we want to move them into a fully comprehensive medical home, because, I mean, the cost of ER, emergency care drops, health disparities improve. So once we get them, we don't want to lose them. So we've had a lot of talks with OU to make sure that there's a primary care referral source on site at Tisdale, as well as that our providers are educated on what specialties on what days will be available at the Tisdale Center for our referrals. So I'm pretty excited about it.
Okay, and let me ask this so that people can understand the distinctions you're trying to make. Let's say if I live in the community and I have high blood pressure, can I expect, so we break it down to that level, can I expect to come into the Tisdale Center and see a provider for my high blood pressure? Or does it have to be where I have to be in some type of cardiac failure or high risk kind of category to see them? I mean,
yes, you can use the Tisdale Center, but you would utilize our primary care component for that.
Okay.
But it would still be at the Tisdale Center. We want to encourage people to come to the Tisdale Center
so we can still
regardless.
come. Okay.
And then it's a great question, because then if you're having some distress, we take a look at the blood pressure, we realize that there needs to be additional tests based upon what we're seeing. Here, let me take your hand and walk you next door to the cardiovascular specialty. And that's the exciting piece of that.
Okay, now how young will you serve at the Tisdale Center? Because you talked about Morton and you have pediatricians, so presumably, and OBGYN, so you're dealing with pregnancy, with birth, to the end of life stages. But with the Tisdale Center, are there age ranges that you will see?
No, what we're envisioning at the Tisdale Center is we'll have a family practice provider. It may be a physician, it may be a mid-level provider. We see that primary care as an entry point. So you come in with a blood pressure issue and you walk into Tisdale. You'll see our provider. It doesn't matter what your age is, because we'll have a family practice provider there.
Okay.
But then the next referral, if you don't need specialty, may be to what I call the mothership, which is our North Lansing site, for child visit if you're a child, medication seminar or a training from one of our nurses. Because sometimes, as you know, folks have 20 million different types of medication and they really don't know what they're for, and some may be out of date or whatever. So my point is that we will try to facilitate the Tisdale as an entry point into a primary care system. But their medical home will eventually be at North Lansing. Now, we have a tremendous transportation system that a lot of people don't know about. We operate buses on fixed routes throughout Tulsa. They run constantly every day that we're open during the week, dropping people off to social service centers, mental health centers, hospitals, government facilities, as well as transporting patients to us.
Wow.
We have an extensive transportation system, plus we also pick up and drop off patients that have transportation issues. We have vans that if you call in and make an appointment, we'll come and pick you and your family up and bring you to your appointment. So we intend to use that as a connection between the Tisdale Center and follow-up primary care. So that if you're somebody that lives in the Tisdale neighborhood and you just don't have, you know what the transportation system's like.
Yes, not very good.
and we find out that that's a barrier, we'll schedule the pickup for you or your family to come to North Lansing for the follow-up care. I mean, it's pretty awesome.
Now let me ask this question, because people may wonder too, do they have to be a patient of Morton to avail themselves of these services? Let's say they're not really a patient of Morton, but they're wanting to go to another provider in that community.
No.
Can they call Morton
No.
and say, come get me?
No, I mean, that there would be no way that we could fund that, but we're finding that a lot of folks that aren't our patients use the bus service.
Okay, so they can use the bus service.
Yes, I mean, there's a schedule that's out. I know that Family and Children's mental health services, their patients use it. Indian Health uses it. Community Health Connections uses it, their patients, because we don't just say we're going to pick you up and drop you at distinct spots. We have many different, you call them bus stops, and some of them include the Indian Health Service, the mental health facilities. So we're finding that a number of people will stop and grab the bus and go on to their next place that they have to visit. And we don't mind that, because those buses have to run anyway, but the smaller vans are expensive, especially with gas, so those are kind of restricted to our registered patients.
Okay, well, in our last minute or so here, what other kinds of initiatives, just mention maybe one that you would want to highlight briefly that you'd want people to know in terms of Morton? Are you involved in certain research efforts? Because people think of research as being key to health care. Are you involved in things such as that?
We're involved right now in exploring the development of a regional health access transportation system with a lot of our partners, which is pretty exciting. That's in its infancy. We're looking at trying to connect medical education and residency with Morton services, so we can build a teaching health center. Morton, our North Lansing site, has 52 exam rooms. We could host residency programs, continuity clinics. We could fill that building up with additional services. Wow. God knows there's needs out there, so we're doing a lot of collaborative exploring right now with OU, with OSU, with Tulsa and Lansing around developing nursing training opportunities. You know, my goal is to try to make Morton a center of health, not only health service delivery, but health education and training.
Excellent. Thank you so much for joining me in Exciting Initiatives.
Thank you for having me.
Thanks. Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your questions, comments, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalertusa@gmail.com. And also visit me on YouTube at youtube.com/Health Alert USA. Take care, check out the services of Morton, and make sure that you get everything your family and you need. Take care. Health Alert is brought to you by OU Physicians in Tulsa.